Hi, Dana Phillips here, family nurse practitioner with All Things Nurse, your place for nurse advice, the things they don't teach you in nursing school. So the video today, I'm going to talk about the two family nurse practitioner credentialing exams, AANP and ANCC. I've taken both of the exams, I've passed both of these exams, and I know that when I was approaching graduation, I was very confused as to what exam to take. So I had to do a little research and figure out what the difference was. Honestly, there's just like minute differences, and neither one is better than the other. Some say AANP is more clinical based, so if you're gearing more towards like a clinical setting to get that certification, and then some say ANCC is more like business based if you're gearing more towards like a management or leadership role. That credentialing is better, but honestly it's completely subjective. As long as you have an exam lined up and you pass it, you get those credentials in place so that you can get your APRN license in the state that you live in. And you do need to pass the exam to get that license. So first I'm going to talk about AANP. So that's the American Association of Nurse Practitioners. This is a standalone organization. This exam is 150 questions and they give you 3 hours to take the exam. And it has an 85% pass rate, and the cost of this exam is $315. If you become an AANP member, you pay an annual membership. I can't remember how much it costs. It's over $100. But if you pay for the annual membership, you do get a discounted rate on the exam, and it's discounted all the way down to $240. So that's a pretty good savings. On top of your AANP annual membership, you have access to all of their continuing education modules. So we need to do continuing education throughout the year to kind of upkeep status for when we need to renew for our APRN renewal for our license. And so your annual membership for AANP includes all kinds of continuing education hours that you can do right on the website. And any other platform is going to charge you a lot of money to get continuing education hours as well. So, it's not like you're going to be able to really get any continuing education hours for free. If you know of a place to do that, please leave a comment and let me know, because I haven't found one. But so the questions on the AANP exam are more geared towards 4 elements: assessment, diagnosis, evaluation, and plan. So you can bet your butt that the questions are going to be based completely on those 4 categories. So a lot of pharmacology, a lot of pathophysiology, a lot of diagnostics. So it's a little bit more cut and dry, if you will. And the credentials that you earn through the AANP examination are FNP-C, which means FNP certified. So next I'm going to talk about the ANCC exam. So the ANCC is the American Nurses Credentialing Center. This is an offshoot of ANA, American Nurses Association. The ANCC exam is 175 questions. They give you 3.5 hours to finish the exam. And this one has an 86% pass rate, depending on what year you're looking at the research. And the cost for this exam is $395. I'm not sure why it's more expensive than AANP. But if you are an AANP member, ANCC gives you a discount. So if you're an AANP member, you can add that into your, like when you're doing the checkout, when you're registering for the exam, and it will give you a very good discount. I paid $340 instead of the $395 because I am the AANP member. And the questions on the ANCC exam are different from the AANP. It's kind of hard to solidify exactly how different they are, but the ANCC questions, you'll find a lot more questions about legality, medical ethics, Also, cultural competency. I had some really kind of out there questions about culture on the exam. So you'll definitely find that main difference between the two exams, personally, I believe. So, and the credentials that you'll receive after passing the ANCC exam is FNP-BC. So Family Nurse Practitioner Board Certified. So, depending on what kind of credentialing you want, you can decide what exam you want to take. But people will always ask you like, oh, what exam's easier? Which one's better? It's so subjective. Personally, for me, my story is I graduated in December, I had a baby in January, and then I had my AANP exam scheduled, but my baby ended up being born on that actual day that I was going to take my exam. So I obviously had to change the date of my exam, which they let you do right on the website. It's very easy if you need to reschedule or something. And so I had my baby. I moved my exam date out 3 weeks, which was super dumb. I totally underestimated how sleep deprived I was going to be. And I did take an exam prep course before I had my baby. So like 2 weeks before. So in another world, I would have been fresh off the review course and I would have gone and taken my exam. And I probably would have done fine. But in this reality, I had my baby, 3 weeks of complete sleep deprivation. I wasn't reviewing my materials or doing any kind of practice questions, and I failed. I failed my first time taking the AANP, and it was like so disappointing and disheartening. I was crying my eyes out and being all emotional about it, but I wasn't prepared. So the main thing you need going into this exam is you need to feel prepared. Whatever that means for you, everyone's so different. You can take an online course, you can do an in-person course. There's multiple companies that offer examinations. I can do a separate video on that topic. And I definitely have some companies that I would want to promote because that's what really helped me pass my exams. So, everyone's different. You got to kind of just do some soul searching and figure out what's going to be best for you in preparing for your examination. So long story short, I failed and I said, okay, I am going to go back in and freaking kill it. And in order to do that, I decided to sign up for AANP and ANCC. And the reason I did that was I said, if I fail this again, I don't want to have to wait a full calendar year, because with the AANP, you can only take it twice in a calendar year. So it was my last shot. If I didn't pass, I was going to be screwed because I need to get back to work. And so I signed up for the ANCC in the event that I failed the AANP for a second time. And so that was kind of like my backup plan. And if I failed the ANCC, then I don't know what I was going to do. I probably should just hang up my hat and say I'm not going to be a nurse practitioner. But anyway, so I signed up for an online review course. In between the time that I waited to retake the AANP, I went back with a vengeance. I slayed the exam. And then at that point, I had already lined up the ANCC. That was actually going to be happening like a month after my AANP exam. So I decided to just go in and take it. I had paid the money and, I was just going to go get it done. And best case scenario, I would be dual certified. And so I just passed the ANCC yesterday. And now I can say that I've lived it, I've experienced it, and I've overcome it, and you can too. So if you have any other questions about the examinations, you can leave comments. Go ahead and subscribe to my channel, and have a great day. Thank you.